Welcome to Adapting Class, and thank you for deciding to join us. We're still on our series on pharmacology for nurses. Top 6 GI medication. As a nurse, if you are in a nursing school or you're planning to take your NCLEX, you must know. Quick information about this medication that you can apply anywhere you want. It will help you answer questions without any problem. The first medication is a PPI. Their last name is what? Zol, omeprazole. What do you use them for? Gastroesophageal reflux or ulcers or GI bleeding. What are the way we can remember them? They are usually called proton pump inhibitors. There's a mechanism involved with acid secretion, and the H plus associated with it is the proton. So we try to like block them. This is why these medications are called proton pump inhibitor. What the NCLEX is going to ask you, or nursing school questions that you're going to get from, is how do you take it? Because it's very important that you teach the patient appropriate way to take it. 30 to 60 minutes before you eat. Ideally, you take it in the morning, but if you take it twice a day, then you may have to do that. There's some medication, is 40 milligram, you take it once a day, or 20 milligram. If it's like more than 40, usually you have to split the dose. If it come in a capsule, don't chew it, don't crush it, just swallow it as a whole. Long-term side effect, key question, nursing question that they will ask you in the school or in the board. C. diff, because of the long-term use of it, it lead to decreased absorption of calcium. So you can get osteoporosis from it, and then reflux associated with pneumonia. So these are the key things you should not forget. What is the mnemonic? I would say omit the acid. It helps with the acid secretion. That's a quick mnemonic. This is not a proton pump inhibitor. Retinidine, they have last name Tidine, right? Formitidine. Don't forget about them. They are not proton pump inhibitor. They can be used in allergy. They are in class of allergic reaction medication. So like Zyrtec and the rest. They are H2 blockers, but this one specifically affect your GI tract. So we can use them for reflux or acid. The key thing is you take them with meal. It's different from proton pump inhibitor or at bedtime. It can cause headache, constipation, and diarrhea. And sometimes IV infusion can cause bradycardia and can lead to B12 deficiency. The way to remember them, histamine, right? Heartburn. These are the medication we all call heartburn medication. They help with heartburn, but they are tidines, they are H2 blockers. They also decrease acid secretion, but they have some allergic effect. But this one specifically, ranitidine and famotidine, associated with the GI tract, does not have too much allergic reaction. Ondansetron. This is very important medication to know because it has a bunch of side effects. It's a serotonin, so be careful in mental health if they ask you. Serotonin, it blocks serotonin, so you can increase this serotonin level in your blood, and so that can lead to serotonin syndrome. Usually, it's an antiemetic, nausea, vomiting, or chemotherapy. It has extrapyramidal side effect also. It acts centrally, so be careful, but that's not the major side effect associated. But you can get EPS symptoms associated with that. The key thing I don't want you to forget is QT prolongation. Therefore, if you taking any medication that can decrease your cause QT prolongation, like magnesium is low, right? You're taking amiodarone or um, you're taking antibiotic erythromycin. These are the mycins. They can cause QT prolongation. So you should not combine them with that. Otherwise, you get torsades de pointes, which is a major risk factor for ventricular and tachycardia. So be careful. The other thing I said about is a serotonin inhibitor, so it can lead to serotonin syndrome. Um, Most of the time, is people who have chemotherapy or they have nausea, we take it. Ondansetron is something you should know. It helps to the nausea, right? Lactulose, another big medication, right, is osmotic laxative, mostly for people who have encephalopathy. The ammonia level is too high, and we want to get rid of it. It causes diarrhea. So you don't have to memorize. It causes diarrhea, but we don't want you to have too much diarrhea. Otherwise, your electrolyte is going to go into trouble. What electrolyte abnormality? Your sodium goes up and then your potassium go down. That's a big problem. It can also lead to what? Pulmonary edema. So be careful about this medication. This is very, very important. You take it with the empty stomach, but if you don't want to, you can some milk or juice is okay. The best way to know if it's working is to titrate it to 2 to 3 bar movement. That is the key. And check ammonia level. How do you know physically the patient is doing well? Check for hysteresis, right? If there's no hysteresis, that means they're improving. Flapping, tremor. Key. That is lactulose. It's a liver laxative to get rid of the ammonia that the liver couldn't take. These are used in patients with hepatic encephalopathy. Dicyclomine. Do you know these medication? These are classic board questions associated with the GI or nursing school. These are little things you have to know. You'll be in the good standing. If you know dicyclomine is a good medication to be familiar with. Used in irritable bowel syndrome. It's an anticholinergic. Irritable bowel syndrome. The major problem is excessive spasm going on. So they have diarrhea within a short time, then they have constipation. So these anticholinergic slow things down and calm things down. It relaxes everything. You should not memorize. You know what anticholinergic would do. Like you can pee, right? Dry mouth, right? Blurred vision. All these are side effects of associated with anticholinergic. Therefore, if you have urinary retention, you cannot take it. If you have glaucoma, you should not take it. If you have obstruction, you should not take it. If you have myasthenia gravis, remember myasthenia gravis, they need acetylcholine. If we block it, they are in trouble. Okay, so these are little things I'm trying to point out in this medication. You don't have to memorize everything about them, but the key facts you need to know about them, so at least you have an idea what the question is going to ask you. If I give you Sucralfate, I'm going to tell you one thing. You should not take it with anything. That's all, because it's a cement. These are little things I want you to learn with pharmacology, right? It does not decrease acid. You will still make acid, but it protects your GI tract. It cements it, it coats it, so that the ulcer can heal itself. It's a protective layer. Because of that, you should not take any medication with it. You have to wait at least 2 hours before you take any other medication. Or you take the medication and wait 2 hours before you take what? Sucralfate. Major side effect, constipation, because there's a cement in your stomach. You should not be surprised. Therefore, what are they going to ask you? Don't take it with any medication. That's all. At the same time, don't take it with any PPI or H2 blockers. Otherwise, it's not going to work. You see how you can master the concept? Now, how do we apply it? Which is the next priority action? A client receiving lactulose for hepatic encephalopathy report having 5 loose stool in the last 6 hours. Test taking strategy, go for the content, underline it, hepatic encephalopathy. What are we doing? Giving the patient lactulose. Good job. But what is the problem? Patient is having 5 loose stool. It lacks 6 hours. Too much bowel movement. You titrate it to 2 to 3 bar movement. If there's more than 2 to 3 bar movement, is you have to intervene because the patient will be dehydrated and they're going to have electrolyte abnormality. Therefore, which of these would you do? Continue the medication, let the doctor know, give them anti-diarrhea so that they will stop having diarrhea, and increase their fluid intake and reassess in 8 hours. Concept, question, and critical thinking. You know you should not have 2 to 3 bar move. You should have 2 to 3 bar moving. Now you're having sex. What would you do? Do you continue the medication? Do you call the doctor? You give them something to slow them down or increase their fluid and reassess? Test taking strategy. 2 to 3 bar movement is the key. Don't let the NCLEX for you, or don't let your exams fool you because you know it's 2 to 3 bar movement. Increasing fluid is not going to solve it. They're still going to have a bunch of fluid, bar movement. Therefore, the best thing is to let the doctor know we are in the priority zone. So number 2 is the right answer. And next is teaching a client prescribe omeprazole, PPI, which statement indicate further teaching is needed. That means they're not saying the right thing. I will take this medication before I eat. Okay, does it need intervention? This may reduce my calcium absorption. Does it need intervention? Content. You see the content, you can change the content into a question. I can take these with what? Clopidogrel for my heart. Long-term use could lead to vitamin B12 deficiency, right? These are all side effects associated with it. What do you think? The bad one that needed teaching is you shouldn't take anything with it. Sometimes it can lead to B12 deficiency, but the most important one is what? Calcium, and pneumonia, and C. diff. But you should not take it with anything. So number 3 is your right answer. This is a tricky question. A nurse is caring for several clients. Which client condition will be a contraindication to dicyclomine therapy? Select or apply. You have 5 patients. Who do you think should not take dicyclomine? Rewrite the question. Dicyclomine, who should not take it? 35-year-old, he has IBS. Should he take it? 42-year-old has glaucoma. Should he take it? 40-year-old diabetes. Should they take it? 28-year-old with GERD. Should they take it? 45-year-old asthma. What do you think? If you're on the line, put down your answer. 5 patients, select or apply. Who should not take dicyclomine? Go down to the content and ask yourself, what is dicyclomine used for? What does it do? And if you know what it do, is it contraindicated in any of these patients? What do you think? Put down your answer. Dicyclomine is anticholinergic. Therefore, who anticholinergic problem will be more dangerous to them? Is it IBS? Is it glaucoma? Is it diabetes? Is it GERD? Or is it asthma? What do you think? I set it to trap you so that you can think critically on when you see question. IBS is what we use dicyclomine for. Glaucoma, anticholinergic is bad. Diabetes does not affect it. Reflux, it does not affect it. Asthma, it does not affect it. Therefore, there's only one answer choice there. You pick those that you're confident. If you overselect, you get it wrong. So glaucoma patients should not take anticholinergic. The nurse should intervene for that patient. Okay, guys, so that's, and the last one. Which teaching, a nurse is teaching a client prescribes Sucralfate. Which statement the nurse should include in the teaching? Select or apply. Underline the buzzword, Sucralfate. Teaching that is appropriate. That's all. Take it with meal for best absorption. Do you take it to food? Take on an empty stomach. Do you take on an empty stomach? Wait 30 minutes after taking the antacid. May cause constipation. Take other medication at the same time. What do you think? This is the content. I rewrote it. You take it with meal for best absorption is wrong. You should take it on an empty stomach. You shouldn't take antacid with it. It causes constipation. Last thing, take other medication at the same time. You should not. So 2, 3, 4 are appropriate teaching. The rest are inappropriate. Thank you for watching. And as usual, if you want to join our crash course, you can email me or go to https://www.adaptingclassreview.com. And then if you want to join our membership, you can join our membership on YouTube. But good